Think your low back pain is coming from your spine? What if I told you it might actually be your pelvis? Welcome back to my series on the 5 most common causes of spine pain. I'm Dr. Bowen here at New Jersey Regenerative Institute, and I focus on treating pain at the source with regenerative medicine treatment options to focus on and support real healing. Today, I'm tackling a real pain in the butt, sacroiliac joint dysfunction. It's one of the most misunderstood and overlooked causes for lower back pain, and you'd be surprised just how often it's missed. You'll notice some overlap with what I was talking about previously, lumbar spondylosis and arthritis. So check out prior videos if you want to know more information. But this can be confused or overlap because the joint sits at the base of the spine, so the low back. Here's your triangular shaped sacrum, and here's your ilium or pelvis, making the SI joint. And at the bottom of the low back, you can see how people can misinterpret their low back pain as not from the lumbar spine, but from the SI joint and vice versa. Now, sacroiliitis, or true SI joint inflammation, is actually quite rare without an associated medical issue. That kind of inflammation usually happens in people with autoimmune diseases like ankylosing spondylitis, rheumatoid arthritis, or psoriatic arthritis. In those cases, I treat it with a steroid injection right into the joint that can be guided under X-ray or fluoroscopy. And sometimes we use ultrasound to avoid any radiation. But what I see much more often is SI joint dysfunction, and that's a very different problem. This joint isn't well supported by muscles. Instead, it relies on strong ligaments like tension cables, and they help that to stay stable. When those ligaments or cables are overstretched or injured, or even have imbalances in the pelvis or leg muscles, you can develop instability and pain, what is referred to as a dysfunction or sprain. Sometimes patients get misdiagnosed with piriformis syndrome because the piriformis muscle lies close to the SI joint and shares a similar force vector or direction. The muscle can spasm in response to the joint instability, trying to stabilize it. So the muscle isn't actually the culprit, it's a victim. When ligaments get overloaded from poor posture, uneven mechanics, or even sudden injury, they can become painful and inflamed. Technically, it's a sprain, but because this area is so complex, we use the term dysfunction more often. Well, my take? Well, the joint may be an issue, but caused usually by the surrounding ligaments and soft tissues that are crying out for help. The pain from the SI joint is often felt lower than typical back pain, right in the buttock, near the joint itself. It rarely travels down the leg, which makes it easy to miss or confuse with other diagnoses. Unfortunately, it's often overlooked while doctors focus on the low back or lumbar spine. SI joint dysfunction is believed to be present in 15 to 30% of people with low back complaints. Some physicians will use a local or numbing agent to anesthetize the nerves that supply the joint to assist in making a diagnosis, while others move right to a joint injection. Traditional treatment usually means a guided steroid injection into the joint, which probably is only good for people with true inflammation. In some cases, more aggressive approaches like SI joint fusion with surgical pins are being used. But that's a big step. My preference? Start by correcting the mechanics. Address the low back, the hips, and even some of the leg muscles because they attach to the front and back of the pelvis and can twist and torque that pelvis, loading that joint. A functional movement screen can be invaluable in detecting these imbalances in stability and motion. If you're still in pain, platelet-rich plasma, or PRP, is a great option. It lets us treat the joint and the ligaments that stabilize it, using your body's own intrinsic healing factors. SI joint dysfunction is a complex issue, but with the right evaluation and a holistic approach, we can find and hopefully fix the real problem, not just chasing the symptoms around. Thanks for tuning into this episode where we learned about the SI joint and its dysfunction. I hope to see you in the next time for discussion on scoliosis. If you found this video helpful or you're enjoying this series on the spine issues, please consider hitting that like button, subscribing to our channel so you won't miss any content. And if you have any other questions or concerns, or you'd like to know anything, can you contact our office? You can also put a comment in the video, and those can help us decide what our next content are to hopefully inform you and provide content that is valuable.